So I'm Lauren Coy. I'm 25 years old. I have lung cancer. So when I was younger, all of my friends, including my twin sister, had grown out of their asthma. I never had any asthma issues. But then when I was around 9 or 10, I started struggling to breathe all the time, like when I was exercising or just anything. And then I would have bronchitis and pneumonia multiple times each year. The point that I would have to be like on an air mask for like a nebulizer, like not just a simple nebulizer, but like a full on air mask, and miss a lot of school. Um, and as I grew into a teenager and going to college, my asthma only got worse. And so they kept giving me different inhalers, different medication. I got more and more bouts of bronchitis and pneumonia. Um, and I would spike these random fevers out of nowhere. And I just had this chronic wheeze that would never go away, to the point that everyone kept calling me wheezy. And like every breath, it would just be constantly wheezing, which is hard when you love hiking and running and doing all the sports. And when I was in sixth grade, I went to like just a primary doctor appointment, and they took some blood work from me, and my blood work came back, with low red blood cell counts and abnormal white blood cell counts. I don't remember if they were low or high or what was going on. So they sent me to, the hospital, which then they sent me to a different hospital because they were telling me that I had leukemia. But then they sent me home, that night, and nobody ever followed up with me on it. It felt definitely in 2021 is when I really started to realize it wasn't asthma. But I trusted my doctors, but I would definitely tell my parents and everything that these inhalers aren't working for me. This medication that they're giving me isn't working. I get bronchitis, they give me antibiotics, and then a week later I have, they give me more antibiotics. And in 2021, I remember just telling my family, I think I have lung cancer because I had like all of the symptoms, like 9 out of the 10 of the symptoms, I had them all. So I had some like leg pain going on for a couple years, and I just thought it was like varicose veins or whatnot. But like my legs just hurt so much. Um, but breathing wise, it wasn't as much pain as it was just like a constant tightness. Like it always felt like something was like squeezing me. And in 2021, I have always been a great swimmer, and I went to go jump in a lake with my boyfriend and his friends. And I immediately hit the water and started drowning. And I couldn't breathe. I was just blacking out. So they dragged me back to shore. And since that day, I just kept getting more and more sick. And I just figured it was because I worked with kids. So I was just getting sick. But they treated me for bronchitis, then a sinus infection, then pneumonia, then an upper respiratory infection. So I had 4 rounds of antibiotics. And then I kept spiking these fevers, and they kept telling me it could be COVID, but I never tested positive for COVID. Um, and so on November of 2021, I was at work, and they sent me home early because I had a long sleeve shirt on, a sweatshirt, a jacket, my 30 below sleeping bag, and I was just shaking. I drove myself to the emergency room. I had 104-degree fever. They tested me for every blood disease there was. They took a chest x-ray, and they found out that I had a collapsed lung, which explained, the reoccurring infections because the infection was trapped in my lung. And they just told me it was a mucus plug or scar tissue that was causing the collapsed lung, and that it'll go away. But at that point, it was like 3 months of being so extremely sick that I knew I had lung cancer. I just kept telling everyone I think I have lung cancer. And me and my mom just said, we are not leaving until we get a CAT scan book. So a month later, they booked my CAT scan, and they told me to wait. And it was a Friday night, and they told me to wait until Monday, Tuesday for my results. But before I even finished driving home, they had called me and told me that I had a tumor, and they wanted me to go see a specialist right away. But the specialist they wanted me to see was booked all the way until April. So they set up an appointment 5 months after telling me that I had, a tumor. I was not comfortable with the fact of knowing that they had missed it for how many months. I had a collapsed lung at that point now since probably September, and now it was December. And then they wanted me to wait another 5 months. Like my lung is collapsed, you know? I had seen my primary care doctor so many times, and I had mentioned to him that I thought it was lung cancer, and he was like, it's not cancer. Like, you're too young, you don't smoke, you don't live with anyone who smokes. Yeah, but of course, then he had to say, like, it could be, but I'm just telling you it's not. So I have seen him a couple times since, and it's definitely been a very different type of relationship. He's apologized, obviously so much for it, but I mean, even my oncologist and all my doctors still, there's no explanation for why I have lung cancer. It's not genetic in my case. I don't have any of the gene mutations. I don't have like I don't live with smokers. I've never lived with smokers. So I had my first CAT scan where they found the tumor on December 17th of 2022. And I went into Leahy Hospital to see my specialist on December 28th. And that morning when I went in, they quickly, before the doctor even like said hello to me, he came in the door and just asked me if I ate breakfast that morning. And I said, I had some cereal and coffee. And he's like, if you didn't, I'd be putting you into an emergency bronchoscopy right now to get that tumor out, because that needs to leave right now. So a week later, on January 6th, 2022, they did a bronchoscopy to remove most of my tumor. And they biopsied it. But they left some of it in there because it was just too dangerous to take it all out during a bronchoscopy. So they took enough out that my lung could open back up in the airway, because it was completely blocking off my airway in my right lung. So it's just a quick procedure. They put you under and they go down through your throat, and they were able to go into my airway and my lung and kind of like cut out the tumor. And then they were able to remove it and biopsy it that way. So it was very quick. I think I was only under for like maybe 45 minutes. So I had for CD, it was CD56 positive, which is a neuroendocrine tumor. They had told me that it looked like it was probably growing for about 12 years. And so that's what kept making my asthma get worse and worse. Yeah. And why I grew into asthma when everybody was growing out of asthma, but it was actually just a tumor slowly blocking off the air. Grew more towards like inwards into the big hole of the bronchial instead of like the lung, but it's a very slow growing tumor is what they said. And a lot of doctors kept telling me, they're like, it's the good type of tumor. And I'm like, is there a good type of cancer? Is there like, and people kept saying like, your cancer was kind to you. It grew slow and took your time. And we could have caught it earlier, but your body more than anybody else does. The doctors can see the test results. They can see you physically, but ultimately your body. And when I was telling everybody that I thought I had lung cancer, even my parents were like, no, you don't. And I'm like, Mom, Dad, you see me here. I'm coughing up, different colors. I'm very sick. But just again, your body and you have to push for it. The doctors don't want to have you they want you to get better and they want you to feel better. Sometimes it's just easy to miss something, especially for your age and for your lifestyle. Like it's easy to miss something, but just force for it. Like my mom is a nurse, and so luckily she was with me that day that I found out I had a collapsed lung, and she just kept saying, hey, I know this routine, we want a CAT scan and we want it now. So if you have to force it, it's that simple. I mean, hospital beds, yes, they want you to go in and get out as fast as possible so they can take more and more patients, because a lot of people go to the hospital for help, but you are also there for help. So if you need to kind of be pushy and kind of be, annoying, so be it. You need the help to get it. And it's not simple, but if you need it, you need it.